Swadikap, and good afternoon once again. Today is Friday, the 7th of May, 2021. I'll start off first with the numbers that we have for today, and of course, to recap to you on the very important information that we have been talking to you about since yesterday. So today, we have 2,044 cases confirmed, with, in that number, 1,820 cases from local transmission and 220 cases from active case finding, and 4 cases from within the state quarantine system. We have 2,377 new recoveries as compared to the new cases as 2,044. So actually for today, the number of new recoveries is more than the number of new cases recorded. Active cases still being treated in hospitals currently is 29,320. And out of this number, 1,170 are in critical condition, while 367 are on ventilators. 27 new fatalities, unfortunately, making the cumulative 363. Out of 27 fatalities, 15 are males, 20 female, age range 30 to 90, quite elderly, and the median age is 61. In terms of the location-wise, in Bangkok, 18 fatalities in that number, 2 each from Samut Prakan and Nonthaburi, and 1 each from other provinces, mostly in the central region. Out of 27 fatalities, 13 were in close contact with infected family members, 5 lived in risk areas, 1 was in close contact with confirmed cases, 1 was a restaurant owner, and another one visited a risk area. So just a breakdown of that for you. In terms of the provinces with the highest number, we might have a slide coming up for you there. Today we have Bangkok as the province with the highest number of cases with 869, Nonthaburi 201, Samut Prakan 165, and other provinces in detail as you see on screen. If we count Bangkok and the peripheral areas of Bangkok, surrounding provinces of Bangkok, it is up to a total of 1,372 cases for today. So some observations from the briefing by Dr. Twisin just now. First of all, the meeting that we had this morning, also one issue we talked about was the Prom application on the application and also online, which the general public can use to obtain the vaccination appointments. Now, as of the 7th of May or today, there is already 1.2 million persons who have used this application to make vaccination appointments. The meeting discussed very importantly on how to adjust the application in order to receive the data for foreign nationals, such as in keying in the field numbers, in terms of keying in passport numbers as well. So that is work that is on the way. The Emergency Operations Center, or EOC meeting this morning also talked about, concluded that there are more beds that might be needed in the next month in terms of the bed supply in the various field hospitals. And more details will be provided later. They are planning on that. Also, that 10 districts with the highest number of confirmed cases in Bangkok from the 6th of May are as follows. First is Klong Toei district in Bangkok, and you have the numbers there of the cases, of the highest number of cases in various districts within Bangkok. So Klong Toei, followed by Pathumwan, Bangkhae, Lat Prao, Ratchathewi, Pom Prap, Satru Phai, and the other districts in Bangkok for your information. Also, the cluster in Bangkhae district. If you recall, we talked about Bangkhae some weeks ago. Confirmed cases to date now is cumulative at 855, and district offices, the district office is being active in their mission to separate infected people in that area from others, especially in Phet Kasem 84 Road, Soi Phet Kasem 84, in that area. And more active case findings are also being carried out in Bangkhae district as well. Now, talk about the number of yes, we have some images coming up for you regarding the various districts that I was talking about just now, Bangkhae district and Phet Kasem Road in particular. That's where one of the important clusters are found. If we talk about the number of critical cases in Bangkok, we have quite a number, up to around 400 plus. Bangkok also seeing the highest number of fatalities during this new wave. So it's very important that we focus on the districts in Bangkok. The meetings this morning, as I mentioned, there are many meetings each day in the morning, the daily CCSA or the EOC and other meetings. The daily meeting today also touched on the vaccination plan, of course, refining it and adjusting it, which will prioritize risk groups according to the Ministry of Public Health. And the Interior Ministry has also been informed of the plan and will integrate this work into their system. So one important information that I'd like to recap from yesterday, of course, that all of you, the English language audience, have been following is about the inquiries on the vaccination plan for foreign nationals. So my colleague, Director Penso, mentioned about this yesterday, and you know that the Director-General of the CDC also talked about this yesterday in a press conference. I'd just like to recap this for a few minutes. First of all, last month actually, when the Prime Minister discussed with agencies and the private sector on vaccine rollout, the Ministry of Public Health had reaffirmed that vaccines would be available for people regardless of nationality. The Prime Minister also talked about this in a speech delivered following that meeting. And today, for example, if you look at social media, you would see that, for example, foreign ambassadors met with the Prime Minister, and the Prime Minister confirmed that equal access to vaccines for all living in Thailand. So actually, this policy, months back, is not anything new, and Thailand remains in adherence to these principles. Now, allow me to speak a little bit frankly today, that sometimes when you see news articles in the press, some things you see in the press, sometimes they are written in a way that the writer feels that is of absolute certainty. The information received is of absolute certainty, when actually many words, any tones in the news articles may cause some misunderstanding and not be actually accurate. In actuality, sometimes it is the same message being written in a different way. So the interpretation has to be very careful. Now, just some point of precaution. When we use the word priority and the word prioritization, it's very common and normal to prioritize everything in life, in work, of course. But the word priority does not mean that those who are not prioritized are left out totally. For example, if I say that I am not a priority for this month's inoculation, it is because I am not 60-year-old or above. However, it does not mean that I am already outrightly excluded. The first priority for 60-year-old senior citizens and those with 7 illnesses, that's the priority set. But of course, it does not outrightly exclude those in the second priority in the list, including myself. Now, please understand that many governments, all governments around the world, face the same issue now. Here in Thailand, we have worked behind the scenes all along. The agencies have worked behind the scenes, some of which the English language audience here may not be aware of. And when such information, such as the information yesterday about the confirmation that vaccination is for foreign nationals as well, when that came out, or when details are to come out in due course regarding the how, in terms of the inoculation, when those issues come out, it is because of the work that has been done all along behind the scenes. Even if there had been any comment or suggestion in the public, in social media or not, the work has been ongoing. And the result of the work is that we release these information, the confirmations that we have, like the ones yesterday, and the means and modes of getting registered, which will come out in due course. Now, some have also questioned about, for example, when we mentioned about that one vaccination center will be in Bang Rak in Bangkok. So some have questioned about the separation of vaccination centers for foreigners that will be set up in due course. Now, if you live in Thailand, you would know the strengths and weaknesses. Any country you live in, you would know the strengths and weaknesses. You would know our resolve. Now, that the best arrangement in Thailand is actually prepared arrangement. It is necessary to prepare staff, for example, to cater to English-speaking audiences in order to be able to manage any vaccination program. That's just one example on why we might be having separate vaccination centers for foreign nationals. Now, as for how, in terms of registration, we're fully aware that the modality and the details are very important, and that will surely come in due course. As I mentioned this morning, we talked about MALPROM application. That is being made to accommodate the English-speaking audience and fields for filling out passport numbers, for example. So that will be coming out in due course, the modality. But in principle, you have that confirmed. It's not any new policy for us. So I'd like just to reaffirm that, as mentioned yesterday, vaccination is undertaken on a voluntary basis in Thailand and is inclusive of everyone living on Thai soil. That certainly includes foreign residents and all diplomatic missions and consular reps and international organizations. And according to the Public Health Ministry, as mentioned yesterday by the DG of the Communicable Disease Department, Thailand's vaccine plan is based on building herd immunity by inoculating 70% of people living in the kingdom. Now, when I mentioned that 70% must be inoculated, it doesn't mean it's mandatory. It means that to reach that goal of herd immunity, we should aim to inoculate 70% of people. And vaccinations in the first phase prioritize those in risk groups that I mentioned, 60-year-old plus, not including myself, for example. Medical personnel, frontline workers, elderly, those with 7 underlying diseases, migrant workers, migrant health volunteers. And in the second phase, which starts in June to the end of the year, that will cover the general public and people working for the public sector, as well as foreign residents in Thailand. Modality to register on the way. The Health Ministry also assigned Bangkok Hospital for conducting vaccinations for foreign nationals and diplomatic community. The Health Ministry is also aiming to provide as many vaccination points as possible as well. And I mentioned this just now. If there is a separate facility to vaccinate foreign nationals, it is for management purposes, it is for facilitation purposes, in terms of communication, language, nurses talking to you in English on your vaccination, on the various illnesses or anything that you are allergic to, for example, your health condition. Of course, that conversation has to be done before any inoculation in English. That's why there has to be proper facilities separate from local Thai nationals. So this will be coming in due course, and Bangkok Hospital might not be the only venue for this, and we'll be giving you this important information as soon as we have it. Regarding the sufficiency of vaccines, 1 million doses of Sinovac has just arrived in Thailand yesterday. Another 500,000 doses are also scheduled to arrive on the 14th of May, before another 2 million doses ordered by the GPO will arrive, the government pharmaceutical organization, will arrive at the end of this month. And this is not counting yet the various other brands that we have been procuring. So just before ending today, I'd just like to mention that physical distancing is perhaps stressful for some and overwhelming if it's kind of expanded or it's kind of extended for many months for everybody. So while being apart from your family and friends, it's recommended that you connect and you socialize with people in various modes and ways, such as via telephone or video call, online connections, social connections. As you can see from the World Health Organization infographic on screen here, and these simple ways of connecting will help you cope with stress, and maintain the good mental health that we should all have. Now, just to end, I'd like to say that rather than look at Thailand as not just one entity, I mean, in terms of Thailand as a foreign country that you're living, and looking whether we're doing something or not, doing something fast enough, and addressing your needs or not well enough. Please don't look at us in that way as one entity. On the other hand, please understand the dynamics within Thailand and the limitations that all governments around the world face, even your governments, even your countries around the world in this trying time, in these extraordinary, unconventional times. So please see yourself as part of our team in the same way that we have confirmed to you, those living on Thai soil, that you are also included in our efforts. We're talking about magnanimity, ความใจกว้าง. We're talking about generosity, understanding, and empathy. So hoping for your understanding and your support, because you're all friends of Thailand. And no one is safe until all is safe. We'll see you at 1 p.m. every day from now on instead of 12 noon. That's an adjustment in the schedule. So we'll see you again tomorrow on the weekend. Thank you very much for your attention. สวัสดีครับ